meet women who made a decision that 30, 40, 50 years ago was unheard of. Everyone was trying to save their breast, and now here there are women who are actually making the decision, after discussing it with their surgeons and doing a lot of research, to remove them when there's no real cause yet. Is this something that we're going to see become a trend now?
I don't know that I'd call it a trend. One of the things that when I have a patient who's initially diagnosed with breast cancer, and it's sometimes hard for them to understand, I'll look at them and say, no woman or man ever died of breast cancer that was in their breast. And they look at me kind of funny, and I'll say, we die of breast cancer if breast cancer spreads outside the breast to other parts of the body. So now that we have the ability to find out that someone possibly has an 87% chance of getting breast cancer in their lifetime, if they perform prophylactic surgery prior to getting a cancer, they can diminish that risk between somewhere to 2 to 10%. And to be able to drop the risk as low as they possibly can prevent an invasive cancer potentially that could cause death had they not removed their breasts.
But it's not necessarily 100% effective. You could perform this kind of surgery on a woman and she could essentially still be at risk for breast cancer?
Yes. And the reason is when you do a surgery to prophylactically remove the breasts, you can remove all the visible breast tissue that you see. You leave a rim of normal skin, and you take the tissue up to the axillary tail. But you can't take each and every single cell. Most cancers come from ductal tissue, and so by decreasing the amount of that tissue that's present, you're doing a surgery that we would normally do for a cancer operation, but even women that have mastectomies that have cancer still have about a 2% risk of getting breast cancer on the chest wall because of that residual tissue. What you have to remember is if this person had an 87% chance, meaning only 13% chance of not getting cancer, now they have a 90% chance of not getting cancer. Big difference. And when these women look at their children down the line, God forbid, if they're one of that, small percentage that would get cancer, they can say, Mommy did every single thing she could to be here with you. And that's a big deal.
It is, and that's one of the reasons we wanted to highlight it on this edition of It's Your Call, so that we could give moms out there, sisters, daughters, wives, an opportunity to hear about this and to tell you about this genetic testing. If you have questions about it, if this is of interest to you, the telephone lines are open, and Dr. Dupree will be taking your questions very graciously. So if you want to call, I suggest that you go to the telephone lines right now. Let's talk about who should consider genetic testing. For example, I'll use myself. My mom is a breast cancer survivor, but it's been 20 years since the last time that she had to deal with this. Is that something that I should consider? Should I have the genetic testing? Or since it has been 2 decades since my mother was afflicted, am I pretty much in the clear?
The amount of time since your mom's diagnosis is a testament to her doctors and her detection, but it depends on the age at diagnosis. So how old was your mom?
52.
All right. Women over the age of 50 are considered to have what we call postmenopausal or just regular progression type of breast cancer that you would get from living past 50. Women that are diagnosed under the age of 50, women who have multiple first-degree relatives, meaning sisters, aunts, grandmothers that had breast cancer, increases your risk. Having a male breast cancer patient in your family, uncles, fathers, grandfathers, increases your risk of having the gene. Having a mother that had bilateral breast cancers, regardless of the age that they were diagnosed. And if you yourself are diagnosed under the age of 50, are also risk factors. The other risk factor that many times, I don't want to say gets ignored, but is not really kind of brought to the forefront is if you are of Eastern European descent, if you're considered of Ashkenazi Jewish descent, the risk of breast cancer in someone of Ashkenazi Jewish background when they're diagnosed of having the gene is about 1 in 40. And that's a big risk. So anyone in my practice who is diagnosed with breast cancer, regardless of their age, if they are of Eastern European Jewish descent, they are offered the genetic testing.
Okay, so for myself and my sister, who is 9 years younger than I am, we don't meet many of those criteria. The only first-line relative that we have is my mother. Fortunately, there's been no aunts, there was no grandmother. We have not had male breast cancer diagnosed in our family to date. We are not of that particular descent. So you would not necessarily look at me and say, Lynn, you need to have genetic testing to see if you carry the breast cancer gene.
Right. One other thing, too, is any ovarian cancer diagnosed at any age and any first-degree relative is also a factor.
Okay.
But other than that, I'd say you are not at high risk for having the BRCA1 or 2 gene. But what I will say to you is because your mom had breast cancer, you are still at risk because you have a first-degree relative that had breast cancer. This goes back to many talks we've had before where we know what the BRCA1 and BRCA2 gene are. We don't know any other genetic mutations that haven't been identified yet. And since there are so many strong histories where I have patients with 4 or 5 relatives that have breast cancer, and they may have some mutation, but we may not have a name for it yet.
So, to go back to, would you suggest then that I do have the testing or I don't?
I don't think you need the testing.
I don't need the testing.
No.
Okay.
But you do need your annual mammogram.
And I do that.
Your breast exam.
I listen to you.
Follow-up.
I take all of your great advice on that, and I always try to be an advocate to our viewers as well and say, take care of yourself. You know, do the daily or the monthly exams. You know, go to see your GYN, get the breast exams, and get the mammography. But if people are watching and they've heard a couple of light bulbs go off in their head because you've mentioned some of those people that they should be watching for, how do they then approach their doctor? Do they say, hey, I saw this TV show and this lady doc said I need to have genetic testing, or can they just request it themselves?
Many different doctors can order the testing. A family practitioner can order it, a gynecologist can order it, breast surgeons, medical oncologists. You want to get your testing with a physician that understands what the implications of the test are, how to interpret the results, and how to counsel you based upon the results that you get. If you get a positive test, you want someone that can say to you, these are what your risks are, these are things you can do to reduce your risk, and these are options that you have for prevention.
And what kind of test actually is it? When we say that we're looking for the DNA, are you basically just taking a blood test?
It's 1 vial of blood drawn just like you would have any other blood test. It gets sent to a laboratory, and they do specific analysis on your blood to look to see if you carry the genetic mutation.
If you want to see more of this episode of It's Your Call, you can with Comcast On Demand. Using your Comcast cable, go to Channel 1, get local, CN8, and then choose It's Your Call, CN8, on air, online, and on demand.